Hello, everyone, and welcome to this presentation. My name is Anna, and I am a MNsure Navigator with Mid-Minnesota Legal Aid. We will have a time at the end of this presentation where you can ask questions. You can put those in a comment under this video. However, please note that since Facebook is a public site, please do not put any private information. If you would like to talk to a navigator about your specific situation, we will have our phone number available at the end of the presentation. Today, we will be talking about Medicare and Minnesota state insurance, specifically how Medicare impacts other coverage through the state of Minnesota. First off, I want to talk a little bit about what Medicare is. So Medicare is a federally managed health insurance program for seniors 65 and over, and also certain individuals who are disabled. Medicare has several components referred to as Part A, B, and D, and you can also buy plans to supplement the coverage. Medicare has several parts, as I mentioned. So Medicare Part A is often referred to as hospital insurance. Part A helps to cover inpatient care in hospitals, skilled nursing facilities, hospice, and some home health care. Medicare Part B is more for clinics and is referred to as a medical insurance, helps cover services from doctors and other healthcare providers, outpatient care, some home health care, durable medical equipment, as well as many preventative services like your flu shot or your yearly wellness exam. Medicare also has Part D, which is the drug coverage. Part D helps to cover the cost of not only prescription drugs, but also many vaccines. You can get Part B by joining a Medicare drug plan in addition to the original Medicare, which is Part A and B, or you can get it by joining a Medicare Advantage plan. And Medicare Advantage plans combine A, B, D, and then sometimes other benefits as well. Medicare supplemental insurance has various forms. Medigap is an extra insurance that you can buy from a private company that will help you to pay for the deductibles and cost sharing on original Medicare. And then also those Medicare Advantage plans can combine Part A, B, D, and then sometimes cover additional expenses that original Medicare does not. I also want to take a moment to talk a little bit about Medicare versus Medicaid. I know that many of the clients I've worked with over the years have gotten these terms confused, so I want to distinguish them. Medicare is for those who are 65 and older, who meet the eligibility criteria, and then again, also certain disabled individuals. It has a monthly premium, and there are deductibles and cost sharings. This program is managed by the federal government. Medicaid, on the other hand, is for low-income individuals, children, and those who are pregnant. It has no monthly premium for most of the programs, and it has low or no cost sharing. While this program is funded primarily by the federal government, eligibility guidelines are determined by each state, and they often go by other names. So, for example, our neighbor Wisconsin calls their Medicaid program Badger Care, and here in Minnesota, it is referred to as medical assistance, or MA. Now we're going to talk a little bit about how Medicare interacts with each of these programs. So medical assistance for adults, children, and families is one of the categories of medical assistance, and anyone over age 65 is not eligible for this MA program. If you were to apply online, you would be automatically reconsidered for Minnesota Care, or you would be sent additional forms in the mail to see if you would be eligible for MAABD, which stands for Medical Assistance for Aged, Blind, and Disabled. The good thing about medical assistance for aged, blind, and disabled is that it is compatible with Medicare. So if you're over 65 and have Medicare, you can also have this medical assistance program. The benefits for medical assistance programs for aged, blind, and disabled vary. There are several categories of eligibility. The benefits can range from paying for your Medicare premium to covering the deductibles, copays, and sometimes other medical expenses that Medicare does not. You might be wondering, what if I'm already on MA and I turn 65 and get Medicare? What would happen? Well, if you're already on MA for the aged, blind, or disabled because of a disability, nothing will change. the county will just note that you have Medicare. It might change how they do some of the billing, but it won't affect your eligibility, and shouldn't affect the coverage that you get. If you have MA under the Families, Children, and Adults Under 65 category, then you should report that you have Medicare, if applicable, and then the eligibility system will automatically try to redetermine your eligibility for MA for aged, blind, and disabled. If you are not eligible for medical assistance or Medicare, then you would be moved to Minnesota Care or a qualified health plan eligibility. If you are eligible for Medicare, then the system will redetermine your eligibility under the guidelines for MA for aged, blind, and disabled. Each of the MA programs has different subsets for eligibility, so the county will request additional information. And once you submit that, then they can determine full eligibility. Some things that will change between MA for children, families, and adults under 65 versus MA for aged, blind, and disabled is that the aged, blind, and disabled category has asset limits. They do vary based on the subprogram from $3,000 to $10,000. And I will note that this does not include the house you live in, household possessions like clothing and furniture. It doesn't include one car that you drive per person, and some burial accounts are excluded. But they will ask for bank statements, retirement account statements. If you have a second car or an RV or a second home, those will all count as assets. The income limits for medical assistance for aged, blind, and disabled are lower than the income limits for medical assistance for families, children, and those under 65, but they do vary by program, so there's a little bit of difference in leeway there. Eligibility categories under the aged, blind, and disabled group are MA, that functions pretty much like MA for families, children, and those under 65, but there are also other options like MA with a spend down, which is where if you're making more than the limit for medical assistance for aged, blind, and disabled, you can spend down the difference. So if you're making $200 more than the income limit, then you can spend $200 of your money towards your medical bills, and then the county can step in and pay the rest. There's also MA for employed persons with disabilities. That program does not have an asset limit, but it does have a monthly premium based off of your income. And then there are 3 Medicare savings programs, and those range from covering the cost of your Medicare premium to acting as a supplement to your Medicare. So acting pretty much like a private supplement would, covering co-pays, co-insurance, the deductible, things like that. All right, so now let's go back to talking about how Medicare interacts with programs through the state of Minnesota. So for Medicare and Minnesota Care, it all depends on if you are enrolled or if you have access and have to pay. So if you have access to Medicare Part B, but you are not enrolled, it is not a barrier to Minnesota Care. If you are enrolled, it is a barrier to Minnesota Care. If you have access to Medicare Part A and you do not have to pay a premium, then it is a barrier. So it's a little bit confusing, but basically, if you have access to Medicare and you don't have to pay for it, then it's considered a barrier to Minnesota Care. If you have access to Medicare and I may have said that incorrectly. I'll repeat that. If you have access to Medicare, but you have to pay for it, then it's not a barrier to Minnesota Care. If you have access to Medicare and you don't have to pay for it, then it is not a barrier to Minnesota Care. However, if you are enrolled in Medicare, then that is automatically a barrier to Minnesota Care, no matter how much you're paying for the Medicare. And then I would note, again, those over 65 but not eligible for MA or Medicare can enroll in Minnesota Care if they meet other eligibility criteria. If you're enrolled in or eligible for Medicare, free Medicare, then you are not eligible for advanced premium tax credits. You can still enroll in or keep a qualified health plan, but you will pay full price. And since the price usually goes up the older someone is, that could be very expensive. You should consider transitioning to a Medicare supplement when you are eligible because it will likely be cheaper. So now we'll go through a few examples of what this might look like in different scenarios. So this is Susan. She has medical assistance for families, children, and those under 65. She'll be turning 65 soon and has her Medicare lined up. She starts receiving letters and forms from the county requesting additional information, such as information about her assets, when her Medicare starts, and the Medicare information, to see if she can be determined eligible for MA for age, blind, and disabled. Susan submits all the needed documents, but is determined ineligible for the program because she has too many assets. Since she is enrolled in Medicare, she is not eligible for Minnesota Care or advanced premium tax credits for a qualified health plan. She decides to talk with a broker to find a Medicare supplement. In example 2, we have Peter. Peter is a lawful permanent resident and has been in the U.S. with that status for 3 years. He is currently 67 years old and applies for coverage on MNsure. Because Peter has been an LPR for fewer than 5 years, he is not eligible for MA or Medicare. Therefore, the system should determine him eligible for Minnesota Care or a qualified health plan, depending on his income. Example 3, we have David. David has MA for families, children, and those under 65. He is turning 65 next month and already has his Medicare set up, and it should start the first day of the month he turns 65. He has been in communication with the counties to submit the required additional information to be determined eligible for another MA program. He receives an approval letter for MA under the age, blind, and disabled category. He is approved for full MA, which will act as a supplement to Medicare. He is also approved for a Medicare savings program, which will pay for his monthly Medicare Part B premium. At this point, you might be a little overwhelmed with the information that we presented and not quite sure who you need to talk to about what. So if you have a question that is specifically about Medicare, I would invite you to contact the Senior Linkage Line, and the number is there on the screen. They have great resources for Medicare, what to be mindful of if you want help finding a supplement, or if you want to know if you're actually enrolled in Medicare, they can assist with that. If you have questions about getting a state health insurance program to act as a secondary to Medicare, or if you're not sure if you're eligible for Medicare yet and see what you might be eligible for through the state of Minnesota, then I would recommend contacting a MNsure navigator. And we just happen to be a group of MNsure navigators. We are Project Care with Mid-Minnesota Legal Aid. All of our services are free. We're grant funded, so you don't have to pay anything for our services. We can help you with new applications, renewals, reporting changes, or if you just want to talk about what you might be eligible for, we can definitely set that up for you. We have appointments available in person, by phone, or by video, and we do have bilingual navigators and interpreters available to meet your language needs. We are based out of St. Cloud, and our contact information is there on the left of the screen. However, we do have in-person appointments available all around central Minnesota, and that lists there from Baxter to Wilmer. And again, we do have phone and video appointments available if you're not able to come in person for an appointment. Okay, so now we will have some time for questions. I'll check in a bit to see if any came through the chat. I would like to remind everyone that we will have this presentation available in Spanish and Somali next week on February 19th. The Spanish presentation will be at 3 p.m. The Somali presentation will be at 1 p.m. So please note that time difference. And then again, you can put questions in the comments of this video, or you can give us a call after the presentation, and you can talk to a navigator on our hotline. All right, let me see if we have any. All right, looks like we have one. So this person is wondering when we go to Monticello. So yes, we are not in those outreach locations in all around central Minnesota constantly. We do have set times when we're in those places. Monticello specifically, we are there Thursday mornings from 9 a.m. to 12 p.m. at the Stella's Health Clinic. Other places, for example, we are at the Buffalo Library on Tuesday afternoons, and but that's every other Tuesday. And then we're in Wilmer every Wednesday. So it just depends on the location. So when you call in to schedule an appointment, you can request your preferred location, and then the scheduler can tell you when the next available appointment is. Okay, let me see if there's any other questions. Oh, yep, we do have another one. So this person is wondering why someone wouldn't just take Minnesota Care instead of Medicare. So assuming that you're eligible for Medicare, the reason why you wouldn't want to do that is because if you delay enrolling in Medicare when you're eligible, there is a penalty that's applied to the premium. So the later you enroll, the higher that penalty is. So therefore, the higher the cost of the Medicare. So I would encourage anyone to enroll in Medicare if they're eligible and maybe talk to someone at Senior Linkage Line if they have questions specifically about that. All right, I'll just wait a few more minutes to see if any other questions come through. And I will remind everyone that our next presentation will be on March 19th at 3 p.m. We do have presentations every month, every second Wednesday of the month at 3 p.m. in English, and then the third and sometimes the fourth Wednesday in other languages. So, all right, it looks like we have no more questions, so I will wrap this up. Again, you can give us a call after the presentation, or you can call or email us to schedule an appointment. I hope that you all have a great rest of your day. Bye.